Coming up on today's update, the first installment of our Women in Sports series. Meet a Jayhawks volleyball player and a sports psychologist helping athletes just like her. Plus, the new tool for treating migraines just approved by the FDA. Good morning. It is Tuesday, March 14th. I'm Jessica Lovell, and welcome into the Morning Medical Update. Speed, stamina, and strength don't really matter if fear, anxiety, and anger take over an athlete's mind. Today, we'll hear how the growing field of sports psychology is giving athletes a competitive edge. But first, let's start with our morning rounds. People with migraines have a new option for pain relief. The FDA has now approved the first fast-acting nasal spray for migraines. And joining us to talk more about this is Dr. Deetra. She is a neurologist with the University of Kansas Health System. Dr. Ford, good morning.
Good morning.
So this new drug is called Zavspret. Tell us how it works.
Yes, this is similar to some of the medications we've had out in the last couple of years. So it works on the CGRP receptor. So this is what we call a small molecule drug. And it basically is going to go in and block those receptors, which blocks the pain cascade response for the migraine.
So what's the benefit of the nasal spray over the pill? Is it just the speed factor?
So speed's a big one. The other thing is that we're hoping that it's going to reduce some of the nausea and vomiting components that come with some of the other medications. Nausea is a big side effect on the other gepant class of medications, so this does help with that component, we hope. Looking at the data, there is still some nausea listed as a side effect, but it is much less.
So in the clinical trial, Zavspret did better than the placebo, but it didn't bring relief for every patient involved. How hard is it, though, to manage migraine symptoms?
So migraines are very difficult to manage, and so a lot of our medications are only about 40 to 60% effective in treating the symptoms. And so the newer classes of medications are looking at most bothersome symptom in addition to just pain response, because some people with migraine, their most bothersome symptom may be the light sensitivity or the nausea and vomiting or the brain fog. And so some of these newer medications are looking at those endpoints as well. And that's where these newer ones are coming in and showing us that within 2 hours they are having some response on those in addition to the pain. So although it's not complete response, we often have to take a multi-drug approach to that to try to find good relief long term.
So Dr. Ford, big picture, we know migraines are miserable. I have them. So many people I know have them. What does this new drug mean for someone who suffers migraines?
It's amazing. So all of these newer drugs are going to be a really big help to us. We use them kind of in our toolbox, if you will. So it's going to be another one to add to that group of medications that we've already been trying, but it gives people another option, especially people who can't tolerate swallowing pills or don't like the dissolvable tablet taste. This is yet another option for them.
Dr. Ford, always good to see you. Thank you so much.
Absolutely. Thank you.
The need for blood donors just got more urgent. Community Blood Center has declared the first blood emergency of 2023. Supply is simply not meeting the demand. Chelsey Smith from Community Blood Centers is joining us now this morning. Chelsey, good morning. Tell us why supply is so low right now.
Morning. Thanks for having me again. Supply is pretty low. We're attributing that to a few reasons. Namely, cold flu, COVID season, we're kind of coming out of that right now. We also had this really nasty stomach bug that's been, we feel, traveling the metro and the suburban areas that's causing tons of canceled appointments. You know, parents are at home with sick kids. Also, spring break is here, so parents are now at home with not sick kids. They're at home trying to manage their kiddos on spring break, or they're going on vacation and they're leaving town completely. We also have a whole bunch of donors that haven't returned since the onset of the pandemic. So it's just a whirlwind of things that have kind of culminated in this drop in donations that's coming at a really difficult time for us.
Yeah, we've got some work to do. So we know the blood donations dropped during the pandemic. You talked with us on our program many, many times. Are they returning to pre-pandemic levels yet?
No, unfortunately not. And in fact, the trend is we're trending a little bit lower than we were even last year. So at about the midway through February mark, we were seeing 2,000 more donors last year than we are this year. We are seeing an increase in repeat donors, which is good, but that's not replacing this loss in first-time donors that we're seeing. So unfortunately, right now, we're trending negatively, and we're really hoping to reverse that trend for 2023 and get us out of this blood emergency.
All right, let's get to it then. If you want to donate, we're going to put the phone number and the website on your screen right now where that you can go to schedule an appointment. Just visit savealife.org. Chelsey, what's your message to someone, though, who may be on the fence, a little hesitant about donating blood?
Yeah, our message for them would be let me rephrase. Our message would be it's never been more important than now to donate blood. We have seen a huge decrease in donors since the onset of the pandemic, and we've not been able to get back to a healthy and stable supply in 3 years now. So March marks 3 years since we've been in this blood shortage. I will say it's not that scary. It's an hour of your time. It's pretty quick, and it can mean the difference of a lifetime to patients who need it.
Such a quick and easy way to give back. Chelsey, thank you so much for being with us. Come back anytime.
All right. Thanks, Jess.
Let's turn to our guest now this morning. Kennedy Ferris is a student athlete at the University of Kansas. She has played for the Jayhawks volleyball team all 4 years of her college career. Good morning to you.
Good morning.
How are you?
I'm doing good.
Good. We also have Dr. Brett Woods, sports psychologist here at the University of Kansas Health System with a history of helping student athletes. But before coming here, Dr. Woods, you work for the University of Nebraska Athletics Department as their assistant director of sports psychology. So we know there is a need, and thank you both for being here. Dr. Woods, I want to start with you because we want to clarify you work with both men and women, but today we're focused on your work with the health system's female athlete program. Why is it so important to focus on the female athlete away from a male athlete?
I think that's a great question. I also think the timing of the question is great, given that March is Women's History Month. Mm-hmm. So I think from like a historical perspective, we're 51 years post Title IX, and I think about having the opportunity to spoke with and hear from some of those pioneers who started Title IX and the battles and challenges they had to overcome for equality. And we've come a long ways, but with that being said, there's still huge gaps that need to be addressed. So we know that in the last 25 years, the research shows that boys and girls start sport at about the same age and in the same numbers, but by about 14 years old, girls drop out twice the rate of boys. And that's been happening in the last 25 years, and COVID just exacerbated that, made it even worse.
So that's how it's impacting you and your work. What are some specific issues that you're hearing from female athletes specifically that are really tailored to female issues?
Yeah. So I'd say overall, one of the main issues that I address is confidence in athletes, and that exists on the male and female side, but how it looks is a little bit different. So for female athletes, there's some added and unique challenges around appearance and body image that can affect self-esteem and self-worth. So look at a sport like gymnastics, where appearance is a part of the evaluation and the judgment and the scoring. And if you just zoom back out, think about some of the social and cultural pressures that female athletes face around ideal body types and drive for thinness, is with that can come sometimes unhealthy relationships with food. Yeah. And so we also see higher rates of disordered eating among the female athlete, and a lot of this is just driven by some of the added pressures that female athletes face around body image and appearance.
Yeah, major compound of the issue, and then creating even bigger problems for these individuals. Kennedy, how young were you when you started as an athlete?
I started playing volleyball when I was about 7, but then pretty highly competitive volleyball about 9 years old.
That's young. Wow. And you've been doing it, you did it all through college. So when did you start thinking about the psychology behind the sport? I mean, you're young. When do you remember thinking about your mindset going into a game?
I didn't start thinking about more like the psychology and sports psych until I was probably a sophomore in college, like post-COVID. I never really thought about it as I was younger. I might have like subconsciously been thinking about it, but never like got into it until about sophomore year of college. So
do you wish you would have started thinking about it sooner? Knowing what we know now and a little bit of what Dr. Woods was talking about. I mean, now that you hear, and I know we're going to talk more about the gals that you coach now, but what do you wish you would have known, and were you dealing with some of those same issues?
Yeah, absolutely. I wish I would have gotten to it way earlier and just had someone even teach me about it. Because if I would have gotten into it before I did, then I think it could have helped me to excel where I've been the past 4 years, even greater than I did. Just because when you get to college, the atmosphere, the distractions, the body image, all of that stuff is even greater than when you're just younger and playing to have fun and all of that. It's not as much of it is competitive, but it's not as like much of like a job or like you have to do this and like you have to strive to win more than just like having as much fun when you're younger and not really thinking about those things.
Yeah, that extra added pressure. Dr. Woods, you were a college athlete. Where and what'd you play?
I was a college football player, and I played at Baker University.
And did you focus on mental health? I mean, as you know, if we go back 20, 30 years, this may not have been front of mind for coaches, and we didn't have specific psychology people who focused on that. So what do you remember, and how far have we come?
We've come a long way. Unfortunately, when I was there, the answer to that question of did we have those resources, the short answer was no. Partly going to a smaller school, we didn't have access to those resources, but the other part of that is when I think about my generation, we were often white knuckling it. We were suffering in silence. So I think this current generation, your generation, has done a lot better job of seeking out help and recognizing it's okay not to be okay and to ask for that support, because in my generation, we just had a lot of people who were scared and afraid to ask for help.
Suffering in silence, that is a big statement. Can you elaborate a little bit more on that, and maybe even whether it be personal or what you saw around you from your other players and friends?
Yeah, so I definitely could have benefited from meeting with a sports psychologist when I was in college. My freshman year, I actually had a pretty severe injury. We were at practice, and one of my best friend and my roommate, I got tackled as I was going across the middle, and I broke my collarbone, tore all the ligaments in my shoulder. And I just remember, for any athlete who's been injured, that recovery process beyond the physical part, there's such a mental toll. Feeling disconnected from your teammates, missing out on opportunities, questioning whether or not you'd get back to where you were before the injury. So I definitely could have used the support. I just didn't have access or know of it.
Not just rubbing dirt on it.
Yeah, you can't just rub dirt on it.
So deep.
Yeah.
And that's, you're talking from a male's perspective. Kennedy, did you feel that? Did you feel... do you feel that need of that mindset help, and what were you hearing from other people?
Yeah, I think the mindset help is a huge thing, especially as a female athlete. Like you talked about, confidence is like everything. And instead of like the fake it till you make it, like I had a really great coach that taught me like be it until you become it. And so like if you are like presenting this like confidence and energy that like you know what you can do inside and stuff, like you will become that if you're practicing doing that every day and all of that. So
I like to write those things down. Be it till you become it. So sometimes I like to steal those, but I promise to credit you fully on that
all
one.
right.
So, but how does volleyball make you feel as far as playing that sport?
I love it. It's like, it's this unique sport that, I don't know, it makes me feel so good. Like I have so much fun, the energy. If you watch me play, like I'm constantly like giving people high fives, I'm hugging people, like I'm cheering for other people. Like that's the part that is so unique about volleyball and that I just like absolutely adore. And it's something that you can't really compare to like anything else.
And you need that love and those touch and hugs like we're seeing here on the screen, kind of to balance out some of that intense play. You have a preferred position on the court, but you didn't always get to play that position, as you told us. How did you keep your mind right when the coach asked you to do something else for the team?
I think just like knowing that some things are out of our control, and just knowing like I like to win, I'm really competitive, so doing what's best for the team in the moment may not be anything against me, it's nothing personal. Just taking time to get better and like working on that mental side of things, but also like the physical side of it as well. I think those, just in those moments, those moments made me better when I was in the role I wanted to be in.
And Dr. Woods, how do you handle and talk through athletes that might feel powerless in a sporting situation? So
one of the things I like to sit down and have conversations with athletes about is I'll have them actually brainstorm kind of what's in their control versus what's out of their control. And I think through that conversation, it usually boils down to what's in their control at all times are three things: attitude, effort, and focus. And I think you spoke to that. Of when I show up to practice, what type of player do I want to be? What do I want to bring as a presence? And I want to bring value that's going to add to the team's success, so that when I'm not there, my absence will be felt. I want to be that team-oriented player that's going to do whatever it takes to help the team succeed. In terms of effort, I want to be able to look at myself in the mirror at the end of the day and ask the question, did I give everything I had? And if the answer to that question is yes, then I have no regrets. I just left it all on the line. And the final one is focus. I think elite level athletes are really great at being present focused, being in the moment, being where your feet are at, and setting really achievable goals. And I think when you do that, when you do focus on your attitude, your effort, and your focus, you'll have a sense of agency and feel more power.
And I love what you're saying, because most of us out there are not pro athlete or going pro or even playing on that competitive level. But everything you said is something I think we can all use every day and everything that we go out and do in our lives. So good advice for all of us. Kennedy, volleyball has been such a big part of your life. What are you going to do after college? Talk to me about that.
I plan to go to nursing school. I want to be a nurse. I've always been a helper and all that. I also am coaching a club volleyball team, and so I like to help them, coach them through all of that. Yeah.
What is there anything that you're sharing with these young gals that maybe you wish you were told back when you were 7, 8, 9? How is that for you as far as now kind of translating that what you know onto them? Yeah,
confidence is everything, especially being young female athletes. Also, like we touched on burnout, it's crazy. I almost quit volleyball when I was 13 years old because I had a coach that wasn't a fan of me, and so that is something I never want them to feel. So I'm trying to teach them to be fearless, be confident. It's okay to make mistakes. It's okay to not be perfect. And that also the sport doesn't define them. So that's something that I was taught in college more. Your sport doesn't define you. It's who you are as a person, not how your statistics are as a player. And I think that's something that I really strive to help them learn at this age, because it will take them however far they go in life.
Yeah, great advice. Dr. Woods, a lot of college athletes have that dream to go pro. Most of them won't. How do you help an athlete kind of transition into a place where they have to just kind of be into civilian life and not go pro, but take what they had with them?
It's a tough transition when you think about the tens of thousands of hours that are poured in and invested into your training. I think as a competitive elite level athlete, when you're young, you dream and aspire to those big dream goals, right, of potentially playing pro sport. And this is partly what got me into sports psychology, is that question of that kind of crisis moment of what next? What do I do after sport? And I think you said it best, of taking a step back and telling athletes you're more than just your sport. Sport is what you do, not who you are. And so I think it's important to have the conversation early, as soon as you can, about identifying what else you are outside of the world of sport.
Yeah, and just because it's over doesn't mean it didn't happen.
Yep.
You're going to take that with you and do bigger and better things.
Yep.
So if you have any questions for Kennedy or Dr. Woods, you can send them to YouTube, Facebook, or the Medical News Network. You can find links to all of those right there on your screen. Let's get a quick check on our COVID count from Deetra Hawkinson, Medical Director of Infection Prevention and Control. Good morning. How are you?
Yeah. Hi. Good.
Hi.
Yeah. Right now we've got a little bit of a bump in our acute COVID cases. So 54 total. 33 of those are active, with, again, a high proportion in the ICU and on the ventilator. 8 in the ICU, 6 on the ventilator. And certainly I know I got a consult and seeing a college-age student who has not been vaccinated, never been infected that they knew of in the past. So the virus, unfortunately, is still out there circulating.
Good to it's just the constant reminder that you've been talking about. Dr. Hawkins, and you noticed a new study out of Finland. I want to ask you about it. Tracked people who got the bivalent COVID-19 booster late last year. What did the study find? Yeah, and we're getting more and more pieces of data from the new bivalent boosters and their effectiveness. We've seen a couple articles in the New England Journal of Medicine and Morbidity and Mortality Weekly Report from the CDC. This is a study from Finland. Again, a snapshot just showing that, yes, especially for those elderly, the bivalent booster did help reduce that risk of hospitalization and severe outcomes. So again, continuing to assimilate all the data, but it all looks good as far as increasing or helping protect people, especially those most at risk from hospitalization and severe outcomes. Let's see if we have any reporters joining us today. Let's get to our community questions. Jeremy has a good one. Dr. Woods, he says, I imagine people often wait to come to a psychologist until they recognize a problem or they've been struggling. And he wants to know, what would you recommend as a healthy time for young athletes to start working with a sports psychologist? That's a great question. I think in general, people sometimes wait until the wheels start coming off.
to ask for help. So what I encourage parents and kids is we don't have to wait until like crisis moment. We don't have to wait until there's a fire to seek out help and support. So if you start to notice like changes in motivation or shifts in mood, if you feel like that burnout that we were talking about starting to set in, like let's nip it in the bud so that we can get to having fun again in sport, so it doesn't detract from you enjoying sport. But sometimes it unfortunately gets to a point where it starts to affect you outside of sport too. Maybe you're not motivated to go to school anymore, maybe you're pulling away from your friends. So we want to try to be more proactive rather than waiting until things get absolutely the worst.
Don't wait. Terry wants to know, do some athletes reject counseling? Is that a hard subject to broach with them?
It can. I think, again, generationally, we're trending in the right direction. You see a lot of professional athletes coming forward and talking openly about and candidly about their mental health. Simone Biles, Naomi Osaka, Michael Phelps, to name a few. And I think that just normalizes. Like, you have these athletes sometimes we put on a pedestal that they're willing to seek help. So I think it just shows the younger generations it's okay to ask for help.
Well, you said we're trending in the right direction, and you mentioned this a little bit earlier, but Lynn wants to know, why do so many people connect athleticism with masculinity?
It's a great question, and I think it boils down to representation. When I go to audiences and I ask audiences, I want you just to sit and imagine the most resilient, gritty athlete. More often than not, they often say male professional athletes because that's what we see in print media, that's what we see on television. So I think we need to do a better job as a society of showing representation of what female athlete resilience looks like. And I think then we get a better sense of it's not just a masculine trait, it is a human trait.
Okay, my question for both of you is, which female athletes did you grow up admiring?
1996, the Olympic squad.
Oh, yeah.
You remember the gymnastics team? Like, I remember sitting on my couch with my sister watching that and just jumping for joy, like this just shared excitement watching Team USA win the gold.
They were fierce.
Yeah, they were fierce is a great way of putting it.
Right?
Yeah.
Kennedy, top 2, 3 female athletes that you look up to?
I would probably say Misty May Trainer. She was a professional sand volleyball player, and she was just incredible. Just the way she played, she was resilient, all of that. I loved sand volleyball in general, but watching her was something special.
Do you follow any other female sports? Or are you just volleyball all the way?
I like to watch gymnastics. Also. I watch pretty much a lot of sports on TV, but I'm not thinking of any specific person.
Yeah, it's just good. It's good to watch, fun to watch. And here's a very important question from Stu for you. When KU and Nebraska play, who does Dr. Woods cheer for? There's really only one answer to that.
I say the Baker Wildcats.
Good answer. Very good answer. I want to get final thoughts. This is just a good conversation kicking off this Women in Sports Week and focusing on them, mind, body, and soul. Just final thoughts, Dr. Woods. What would you like us to know?
I like to just say that the female athlete program in the Kansas City area, we just got up and running. It was the brainchild of Dr. Lisa Vopot, and so I want to give her credit. And I'm just fortunate to be kind of a spoke on that wheel to provide the mental health services for that program. And I think it's going to do amazing things for the female athletes in our community.
Yeah, it's exciting to see where we're going to be generations from now. So thank you for your work. Kennedy, final thoughts.
I think just if any young female athletes are watching, just be yourself, be confident, be resilient, and also if you need help, it's okay to ask for help. Yeah.
And don't fake it till you make it. Be it till you become it.
Correct.
Right.
Yes.
Okay. I got to get that tattooed somewhere. Maybe. Dr. Hawkinson.
Yeah.
Probably not a good idea.
Yeah, I think this is a microcosm conversation about really something that is certainly broader and affects especially younger kids, adolescents, young adults on an everyday basis, due for multiple reasons, but I think it is good to understand those troubles that you're having, those pitfalls, and really try to seek help if you can, because there are so many pressures put on everybody in today's society, but especially our adolescents and our young adults.
Absolutely. Dr. Hawkinson, thank you. And before we go, we are excited to say our live coverage from Royals spring training begins tomorrow. We're going to take you live to Surprise, Arizona, where spring training games are already underway there. Tomorrow, we'll talk with Dr. Jake Brumbacher, a hand surgeon and team physician for the Kansas City Royals. Then coming up on Friday, we're going to be talking with the head team physician, Dr. Vincent Key. Thank you so much to all of our guests. Great conversation. Thank you, as always, to our viewers for being with us today. We'll see you back here tomorrow. tomorrow at 8. Getting off the sideline and back in the game. One high school athlete went from crutches to an operating table, then back to the pitching mound. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Our Women in Sports series turns its focus toward injuries, both healing them and preventing them. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.